Hi, and welcome to Coffee with Claire. As you loyal fans know, we bring to you business leaders and entrepreneurs who like to give back and have fun. My guest today is David Mair. David is a healthcare executive. He's a leader in insurance, travel and logistics, and risk management. David has helped define destination medical care. Please join me in welcoming David Mair. David, welcome to Coffee with Claire.
Thanks, Claire. It's great to be here. Thanks for having me.
I am so excited to talk about your topic. Today is a really educational day, I think, for a lot of people, because usually me, as well as other people, when we think of medical travel, we think of like a care flight helicopter. And I know that that's not exactly what this is. So how do you define medical travel?
Well, we really look at it, Claire, using the term destination medical care, which is really taking where you want to go for medical care and choosing it based on some very common factors: access, affordability, quality, and the outcomes that we can get. And interestingly, it's a 4,000-year-old process.
Wow.
And we engage in it every day. We just don't call it destination medical care.
Okay.
So when you make a choice to go to a doctor or a hospital or a dentist or an eye doctor, other than the closest one to you, you've made a destination medical care choice.
Well, that's true. Yeah, I hadn't thought of it that way. You know, so it sounds like it's more about matching a patient to the care that they really need, no matter where we are. So like I'm here in Dallas, and there might be a healthcare professional in Florida that really matches what my needs are. Is that kind of what we're talking about?
Exactly.
Okay.
You know, if you think about it, there are centers of medical excellence that have cropped up around the world. For us here in Texas, we think about MD Anderson, the cancer center in Houston,
right,
where people will travel from all over to
yeah,
go there
the
because
Mayo
of the
Clinic.
again,
You hear about, yeah.
Exactly. Johns Hopkins, the TIDA International Cardiovascular Hospital in Beijing, of all places.
Wow.
So hospitals around the world that have built reputations for delivering outstanding care.
So you've told me in previous conversations that this is a developing industry that's guided by divergent groups until now. So who's driving the innovation now?
Well, it's really beginning to consolidate, Claire.
Okay.
So there was a time when a lot of the facilitators kind of drove what was happening. These are people who would connect with patients. And actually a former company of mine, a company that I owned at one point, was involved in that business. And our job was to take someone like you who has a medical need and then say, where's the right place for Claire to go? Without regard to international borders. And that's the thing that's different for people today.
Okay.
You know, we're accustomed to going across town. We're accustomed
Right.
in some cases even to going across state lines or to the, somewhere a little further away.
Right.
What we've now said is let's expand this globally.
Yeah.
And find those hospitals that match up with what patients' needs are, particularly when they're driving either significant cost savings or significant advantages in the ultimate outcome. Because as a patient, whether it's you or me or the people that we care about, they're looking for the best that they can find.
Absolutely. And if you can save some money in the process, that's even better. You know, better healthcare and less expensive. Where is there an argument? I don't see one.
It's hard to find a disadvantage.
Yeah.
Other than the fact that it seems for people still very, very strange.
Yeah, and almost like, is it real? I mean, is this really gonna be what they say it's going to be, or is it going to be a shell game, or a bait and switch?
Destination medical care done really, really well deals with that challenge.
I bet.
Because it's hard for people to know, is this a great hospital somewhere else, or is it a pretty good hospital that maybe has a great website? So part of what happens is that there are people that are out there, Joint Commission International, for example, who accredits hospitals internationally, and that can become a sign for people that this is in fact a hospital that's doing a very good job.
Okay.
There are others, like what we do at International Hospital Corporation, where we do the job of vetting. In our case, it's through the hospitals that we own.
Okay.
But we also work with partners whose role is sorting out the best of the best from the rest.
So do you have just like a database of information, or do you know these doctors personally? How does that work?
You know, it's interesting that you asked that question, because it starts with finding out who the doctors are.
Mm-hmm.
I actually began doing this, interestingly enough, with Olympic athletes 30 years ago.
Oh, really? How fascinating.
As athletes were traveling around the world, one of the things that would happen is they'd be injured or ill, just like anybody else.
Yeah.
But they're looking for care that's a cut above what others would do.
You bet.
So our job began to be to find those doctors and hospitals for them as they were traveling around. For me, that grew out then into doing it professionally for individuals. And now what we've done is we've built it out of that old sense of this being the purview for high net worth individual patients seeking cosmetic surgery, to now being something that's available to people of all economic brackets, all medical needs, as well as the companies that provide their health plans.
Oh, wow. So insurance might cover this sometimes?
In many cases, it does.
Oh, that's even better.
Absolutely. You know, one of the great advantages, and one of the things that we've brought to this at IHC, is our working with companies that have self-funded health plans.
Okay.
As well as other companies working with their insurers or their plan administrators and others, so that we can reduce the out-of-pocket expense for the individual consumer, number one, and then ultimately for the company as well, because those savings translate into premium reductions, or at least limitations on growth year over year. So for the companies that we work with, we're actually helping them manage their healthcare costs by providing their employees, the patients that need care, with more affordable, more accessible options.
And does it have to be a certain size company for you guys to be able to work with them? Or can it be a solopreneur? How does that work?
We can work with individual patients.
Okay.
Or we can work with companies of 10,000 to 20,000 employees and up. I mean, it really has become that element that's available for everyone today in various levels. You know, one of the places from an individual perspective is the cost of prescription medications.
Oh yeah, it's so expensive.
We hear the headlines every day about how expensive it is.
Like people having to choose between prescriptions and food.
Yeah, or cutting their pills in half, or not taking what they need. And boy, that's the wrong thing to be doing from a medical care perspective.
Right.
So, but it's very expensive, particularly when we're talking about specialty medications. So one of the things that we've done is put together an international pharmacy arrangement where patients can come and get those medications at significantly reduced costs.
Oh, wow. So their physician would just call in the prescription to your international center? Is that how that works?
It's a little different. It's a little different than that.
Oversimplifying, I'm sure.
No, it's a little different than that, but it has some of those same elements. The FDA allows patients to import for their personal use up to a 90-day supply of a medication, as long as it's already FDA approved.
Okay.
So what happens is that patient will come to our primary hospital in Costa Rica. Mm-hmm. They'll see a doctor who will confirm that the prescription that they've already been recommended is what they need.
Okay.
We'll do lab tests if that's what's necessary to confirm that the patient's medical condition is still appropriate for that drug. And then they purchase up to a 90-day supply, and they bring it back home with them.
And they buy it from the Costa Rica location?
They buy it
so it's less expensive?
One of the examples that I can offer you, and this is not an extreme example. I can go out on the high end if we want to do that too. But from a practical perspective, I had a conversation with an employee from the school district here in the Dallas area recently who was saying, I'm spending $5,000 a month on my medications.
A month?
A month.
On a teacher's salary? Bless their little hearts.
I know, it's hard. I mean, imagine trying to make that, and it's a 2-income family, but imagine trying to do that.
Still.
I know, it's. So I looked at her and said, let me do something for you, because I need to validate and just check the cost of the prescription. Well, we're at $1,700 a month,
Oh my gosh.
Claire. So
That's a
seven-
house mortgage.
well, 1,700 times 3 is 5,100 for a 90-day supply.
Yeah.
We're $100 within $100 of what she was paying a month. So she's now gone back to the school district to say, I want this.
Yes.
And the school district has come back to us to say, how do we get that?
Yeah, for everyone else.
For everybody. Yeah, exactly. For everyone.
Because they're going to save money. The more money's going to go to the kids, which is where the money should go, and maybe even some salary increases just because they're saving so much money on medical.
Exactly.
Who knows where it can go?
Exactly. I mean, I had a shoulder surgery earlier this year. I think I'd mentioned that to you one of the times that we met. Well, you know, I looked at what my shoulder surgery cost me in Costa Rica against what it was going to cost here in Dallas.
Mm-hmm.
Here in Dallas, the total cost to my plan, not to me, but to my plan, was about $37,000.
Wow.
Costa Rica, it was $18,000.
My goodness.
So imagine being a business owner,
Yeah.
or even a corporation where you've got shareholders. Now take that savings times 10. I've got 10 patients who have that kinds of savings, and now we're talking about real money.
Yeah.
These are significant savings for employers and for the individuals at different levels.
And so what part does your company play in all of this? Are you guys the matchmakers? Are you the logistics folks? How does that work?
International Hospital Corporation, Claire, owns and operates hospitals in Latin America.
Okay.
So we're kind of on the provider side of the equation.
Gotcha.
And one of the things that attracted me to the company, having been in this now for about 25 years, was that we've got a very, very fine hospital here in a country that attracts medical and dental travelers already. So it was an opportunity to revise and do some things with the patient experience in addition to the overall medical care. One of the things that we often hear at our primary hospital, Hospital SEMA in San Jose, Costa Rica, is that patients, when they leave, they say, I felt more like a guest than a patient.
Oh, really? That's amazing, because you always get so scared going into hospitals, and it feels so stressful. And if you can reduce that anxiety by feeling, like welcome and like a guest.
One of the things that's interesting, there was a survey that was done not too many years ago that said that for those of us here in the U.S., we typically spend 27 minutes in the waiting room to see our doctors for 7 minutes.
Yeah,
well,
that's probably about right.
In our hospital in Costa Rica, there's very rarely ever a waiting time, and it's not unusual to spend an hour with your specialist.
Really?
It's just a different kind of environment. So you're getting questions answered in comfortable ways without feeling rushed. You get to talk about not only the specifics of your medical condition, but how that impacts the rest of your health. I was talking to someone recently who said, I've had a knee issue for a really long time. So, well, what does that mean to you in terms of quality of life? He said, I can't do the things that I want to be able to do.
Sure.
We get it. So let's get you out of line for medical care and get you to a place where the quality of care is comparable or better, and get those issues resolved.
And it sounds like the outcomes are comparable as well, or maybe even better.
Well, and that's the thing that any patient should look at. As you look at a hospital, and we kind of don't think about it because we're largely in the U.S. driven by what our insurance company suggests.
Pretty much.
And I use suggest kind of loosely there. It's really driven by, is this doctor or hospital in my network or not? Mm-hmm. We often don't really know what the quality of that is going to be.
You have no idea.
No.
Especially if it's a new specialist that you get referred to. It's like your regular doctor has to tell you to go to the shoulder guy.
Right. And there are some sources that are out there that begin to do some of those ratings, but most people don't know about them. So part of what we do is, particularly at our hospitals, we've chosen the best of the best to put in our international patient panels. So we've got doctors that are trained around the world. Many of them are members of U.S. medical societies. Many of them have been trained in the U.S. and have chosen to go back to Costa Rica to practice medicine because that's where they started.
Oh, that's cool. So who are you telling this story to right now? I know that we met at a networking event that was for medical professionals. But what else are you doing to get this really important message out?
We try to spend as much time as we can, Claire, talking with employer groups,
Okay.
human resource managers, benefit managers. We talk to people in specific groups around medical conditions. One of the great pieces of social media is there are a lot of groups that have built themselves around, community of people with a common medical issue.
That's true. I hadn't thought of that.
And
but
so
yeah.
we talk to patients who have muscular sclerosis, for example,
Okay.
an autoimmune disease. It's very, very difficult, and because we've built out a program that takes what was at one point an experimental procedure, which is now approved by many insurance companies, or an increasing number of insurance companies at least. But there's a backlog because there's so few physicians in the U.S. that offer it at this point.
Okay.
So we've chosen to focus there. We also talk to patients who are on specialty medications.
Okay.
So it's because of what destination medical care is, so much of it is conversational. Because as much as you and I enjoyed the first conversation we had, there are always those aha moments
Right.
of, oh, wait a minute, I didn't know this existed.
Right.
Which is kind of the first obstacle.
We got to let the people know about this.
And then the next one is the question that you asked a moment ago, is it real?
Yeah.
And the answer is it is. And as people begin to understand that, the next question is, well, where do I go? And so we help them through our partners and directly in making those choices. We're fortunate to work with some great people who also do outreach on our behalf. So lots of conversations around what is it that we do. And as we've done that, we get increasing numbers of people who are going to our website or picking up the phone and saying, okay, can you help me? And in most cases, the answer is yes. And because we don't do everything for everyone all of the time, I mean, no hospital really can.
No.
We also try to refer those people that we can't help to the places that
that's great.
that they can find what they need.
So you've vetted some other resources for those individuals. Go ahead.
One of the advantages of having been in this business for as long as I have is that you get to know the people who are really good. And so when we can't do something, we're sending people to places that it can be done.
Well, and that just goes back to your reputation. If you're, providing high quality care, people would expect if you refer them to someone else, they would provide that same quality.
There's that element of honesty that comes
Yeah.
with it.
Yeah, and trust.
Absolutely.
People got to trust you. Yeah. So, okay, so I'm a patient and I am coming to you. Walk me through the process. Do I have to fill out some kind of special application? Do I have to be referred to you by my regular doctor? How do I get started?
Most of the people who contact us first are contacting us directly.
Okay.
And then because of the protocols that we've put in place, we like to then get some medical history so that we know, let's just say that it's you.
Okay.
So that we know what you're dealing with.
Right.
What's the medical condition? Let's look at medical records. Let's look at images. Let's look at some other kinds of things so that we can get you lined up with the most appropriate physician for your condition. One of the next things that we do is we get you on a video conference with that doctor.
Oh,
so
okay.
that you can already start to talk to them to say, okay, do I like you? Do I trust you?
Yeah.
Are we going to get along?
That's great. I didn't
And
realize you
so
did that.
we've done a number of those things, including then taking the next step of telling you what it's going to cost. We've priced that procedure for you before you ever buy an airline ticket. So that by the time you've made the decision to go, you've gotten as many of the questions that you could possibly think of already answered. Once you then arrive at the airport, we pick you up. We have a 4-part security protocol so that you know that it's our person who's picking you up. We know that it's you. It's done by facial recognition. One of the things that people don't think about, and they're concerned rightly about traveling to some parts of the world because it's just not safe. Fortunately, Costa Rica is not one of those. But we've used the same security protocols that I built for Olympic athletes anyway. So I've sent you a photo in advance that says I'm the person who's going to pick you up at the airport. So you're not looking for a name on a whiteboard.
Yeah.
You're looking for my face. I've gotten your picture, so I'm looking for your face which is so much more comfortable when you get there.
It just feels so much more. It does. It would make me feel a lot more safe.
Hospital is then 20 minutes from the airport.
Okay.
So we get you there, we get you checked in, we do all the medical work, and then we do the same thing in reverse going home.
Oh, awesome.
And then when you get home, we talk to you and your local physician so that he or she knows the procedures that you've been through, so that they're ready to maintain that continuity of care that's so important to all of us as patients.
Yeah. And did they ever talk to the physician that treated them in Costa Rica too?
Happens quite often.
Like if something comes up, and they have a question. That's awesome.
Yeah.
And you guys, so you really are matchmakers and bringing people together that really need each other for a specific reason for a certain amount of time.
That's a very interesting way to put it. Yeah, it's it is our job to take someone who has a situation of need and get them with the right resources so that at the end of that process, they're going, I feel better.
Yeah.
I can do the things that I want to be able to do. I can golf, ski, dance, run, walk, pick up my grandchildren.
And not mortgage my house for it. Because they want to, that's the scary part about medical stuff, is that we don't understand the terminology a lot of times. And then on top of that, there's this big price tag on it. And so there's so much anxiety around it. You say yes to anything just because you want to get well, and you guys are given a way better alternative for people to be able to assess their options, make really good choices for themselves, and to get really fantastic health care.
And so much of that comes because, I'll do it this way. If you or I today were to pick up the phone and call our doctor or our hospital and ask what a medical procedure is going to cost, it's a trick question. They can't answer that. Yet, for many families in high deductible plans, the first $12,000 comes out of their pocket.
Wow.
Well, imagine trying to buy a car that way. We'd never do it.
No.
But we do it with medical care all the time. So we've tried to build more transparency through destination medical care so that going in, this is an $8,000 expense. Mm-hmm. And with your insurance company or with your employer or whomever is paying for that along with you, then it takes the uncertainty out of that process. And makes it easier for everyone in the end. It's a much more comfortable process.
Yeah. Well, David, how can our audience contact you and find out more about you and your company?
The easiest way to catch us, Claire, is to go to one of our two websites.
Okay.
They can reach International Hospital Corporation at ihcorp.com.
Okay.
Or the hospital site at hospitalcima, CIMA.com.
Okay.
Both of those sites have our contact information. They can then reach out by phone, by email. We've got web forms, and we've got people that are standing by to help.
Well, that's awesome. Thank you again, David, for joining us today here on Coffee with Claire. And thanks to our listeners and our viewers as well. Please be sure to like us on Facebook and follow us on Twitter, Instagram, and LinkedIn, and subscribe to us on iTunes. We'll see you next time on Coffee with Claire. Bye-bye. Thanks for tuning in to this week's episode of Coffee with Claire. To learn more about today's guests, visit their website or find them on Facebook. To learn more about me, Claire Billingsley, follow me on LinkedIn or visit my website at coffeewithclaire.tv. And to hear more episodes of Coffee with Claire, subscribe, rate, and review the show on your favorite podcast and social media platforms.